I'm Matt Willis, Public Health Officer for Marin County with a COVID-19 update for February 17th. We're approaching the last week of the pandemic state of emergency in Marin County and for the state of California. This is an important opportunity for us to step back and consider the long game. Those things that a month from now or even next year we'll be continuing to prioritize and to track. And today we're launching a new website, a new dashboard in Marin County that will highlight that more streamlined set of indicators we'll be tracking together. In short, we're going to be looking at hospitalizations, we're going to be looking at wastewater, we'll look at outbreaks, and we'll look at variance. Those are the four main things we're going to be tracking in terms of outcomes, and then we'll also be looking at vaccination rates. I'm going to walk through the dashboard now with you in real time, just to familiarize you with this tool and some of the interactive elements. And I'll share my screen and we'll walk through it together. So this is the dashboard. This is the Marin County COVID-19 surveillance dashboard. And right off the bat, the key indicators start differently than they used to. We used to see case counts here, our epi curve. Now you'll be seeing wastewater. The default is the aggregate, that is the sum total of all of our 6 different wastewater catchments across the county of Marin. About 90% of our residents are represented in one of our wastewater sewer sheds, we call them. And this is over time, and then the number of virus particles, the concentration of virus in the wastewater. On the upper left, you have the opportunity to toggle down into one or another community within Marin. And I just clicked on Central Marin just to show that feature, and it shows the wastewater levels are about the same, or the trend is about the same for the county as a whole. And that's wastewater is how we'll be really looking at virus transmission rates at the population level rather than case counts. The next is hospitalizations. We'll be looking at hospitalizations every day, and it's basically the most important indicator of severity of illness and the burden of COVID-19 on our healthcare system. And we'll be looking at the total number of people on any given day in all 3 of our Marin County hospitals with COVID-19. Then that blue line shows the number of people who are hospitalized for COVID-19. That is that they're in the hospital because they were infected with COVID-19. And then that orange line at the bottom is the number who are in the hospital in the ICU. And if you see here 10, that's yesterday. So it's about a day delay. 10 in the hospital with COVID-19, and that's down from the peak of our latest surge was on Christmas Day of 2022, where we had 36. So just less than 1/3 of that. The next indicator we'll be tracking together is our variance. And this goes back to when we first started tracking variance back in summer of 2021, and shows in green, Delta dominance, really just very, months of just Delta. Then Omicron hit, and Omicron 1 in the pink there, then Omicron BA2 in the purple, and then the red is BA5. And now more recently, and this is another fun feature of this dashboard, is an interactive element where you can toggle across for time. So let's go up to the more recent time. And this shows just the past few months. And what it shows there is that we're really seeing the dominant 3 strains are really dominant together. And I can't see any particular pattern of one being more than the other. The red is BA5, the orange is BQ, and the yellow is XBB. And so this shows really a new era compared to those earlier eras where rather than having one dominant strain, we're seeing various strains that are all circulating at the same time. Importantly, we're not seeing signs that any of them is causing more severe illness than prior strains. The next feature of the dashboard is outbreaks. This is long-term care facility outbreaks, obviously an important priority for us, something we've been working hard to prevent and mitigate throughout the pandemic. And this just shows the number of facilities having outbreaks at any given time. And you'll see there we have 10 facilities currently experiencing an outbreak. Of our 70 or so long-term care facilities countywide, The definition of an outbreak is very sensitive. It's even just one case that's been acquired in the facility is considered an outbreak by definition. And this is something that people can track moving forward on the website. Next is our vaccination rates. So vaccines are our most important asset and the most effective tool for preventing COVID-19 illness and severe infection. And this is a state-run dashboard now, looking at the California Immunization Registry, and it organizes all the results by county. And the default here will be for Marin. And we can go to Marin here and show our vaccination rates. And this is where my eye goes. When I look at this, this is the bivalent booster rates for Marin County by age. And this is the group that I'm most concerned about. Our 50 and 65 plus. 64% of residents in Marin above age 65 have received that bivalent booster. That's about 20 percentage points higher than statewide average, but still not enough, especially since what we just looked at with our wastewater and hospitalizations, knowing the virus is still active in our community. Other indicators you'll find on the website include just this overall tally over time of mortality, all-cause mortality across the county. And this is the way that we might see blips or increases in death rates, which we are not currently seeing and have not seen across the board since the start of the pandemic. Case rates will be found at the bottom because, as I said, they are no longer reliable indicators of community transmission. This is the state dashboard looking at case rates and deaths. And what's different about this compared to what you would have seen last week when we were tracking this in Marin is that the state adds San Quentin State Prison population to this. So you'll see a bit of a jump in our cumulative deaths and a jump in our cumulative case rates. And that's because of that addition of the San Quentin population. And I'll remember back when the outbreak that occurred in that community where there was about 30 deaths among San Quentin inmates. So those are being added to our cumulative death rates as a county. We hope that's a helpful walk through our dashboard, our more refined tool for measuring what we think are going to be the most important things to track moving forward. We trust that as a community, you'll be able to continue to use the best available and latest information to inform your own behavior and to act to protect yourselves and one another, as we have for the past 3 years. Thank you for doing your part.